Well, how many people here watching this video right now have the best bladder control you've ever had? Pretend like we're in the audience. You can raise your hand right now. You're having the best bladder ever. Well, just kidding. The real question is, if you're watching this video, if I could show you how to have a 70 to 100% improvement in your bladder control, would you be interested in that? That's what we're going to talk about today. Whether you're using absorbent pads to get through the day, you're insecure about how many bathroom trips you're going to have to take and whether there's a bathroom nearby, whatever your issues are, I'm excited to share with you the opportunity to get a 70 to 100% improvement. So pay close attention to what we're going to go over. And I want to tell you, by you being here and listening to this webinar, I want to congratulate you. For every person that clicks on here, there's 100 people that should be watching this, and they just pass it on by. They don't make the time, they don't commit to themselves that there's new solutions that they just need to uncover for themselves. So this really, I just want to commend you. Your presence shows commitment to finding real solutions. So today what we're going to talk about, this is about a 25-minute talk, and what we're going to cover is essential for you to know exactly what your options are out there. We're going to talk about the truth about standard treatments, the root causes that are revealed that are often not known about incontinence issues, the risk of not taking any action, and then we're going to go over the proven solutions and your very next step to recovery. So this talk is for you if you have sudden urges where you're not sure if you're going to make it to the bathroom or not. If you have those type of stress, like whether it's you're laughing, you're sneezing, you're exercising, they call that stress incontinence, where you have leakages when you're laughing. Some people, it's minor drips. They think it's normal, but it's not. And those minor drips can become into streaming of loss of bladder control and embarrassing moments. Some people are concerned about nighttime trips to the bathroom. Getting up in the middle of the night can be dangerous, right? It's dark out. It's a lot of times the light, you don't want to turn the light on. And so people have trips and falls. It's one of the number one causes of falls in seniors is those nighttime trips. And so, you go from taking one nighttime trip to one every hour, every 2 hours, and it just builds up over time. It's not acceptable. And then is it affecting your activity planning? You're going out with family, doing fun things, going to the movies, going out to dinner, being around friends that you're concerned, you're stressed about planning activities around a bathroom. And so you start avoiding doing things. If any of these things you relate to, then again, you're in the right place. What people don't understand that this industry is a $16 billion industry between the medications, the diapers, and surgical interventions. All these temporary solutions are there. It's a massive industry. And so people are constantly just giving these three things, whether you got to live with it, and if it's bad enough, you wear pads, or you take these medications, or you go under risky surgery. And that's a $16 billion industry right now. There's close to 50 million sufferers of incontinence in our country. So what happens is you need to think about it like this. Our current standard of care approach to helping people with incontinence is basically equivalent to driving your car and your check engine light comes on. Imagine this. Let me ask you a question right now. If you're driving your car out there and that check engine light comes on, what are you doing? What are you going to do in that moment? Well, I know some of you will say, I'm going to go right down to the mechanic and ask them what's going wrong and see if they can fix my car. But the truth is, a lot of times we just drive around hoping that light will go off on its own. Well, what's even worse, most of our healthcare industry works on the premise of, hey, let's just cover up the light so you don't see it. And so that's what a lot of these medications, a lot of these approaches to our health, including incontinence, is let's cover up the symptoms. And it's like going to the mechanic and putting a piece of duct tape over your check engine light and saying, you're fine, keep driving. And we all know what's going to happen with that. If we don't address it, your car is going to break down completely. And with incontinence, whatever your symptoms are, typically they're going to get worse with time. So ignoring it, putting a Band-Aid over it with treatments that just work on the symptoms is not the right solution. You want to do more than putting duct tape. You want to get to the root cause. So your body has warning signs. So like the check engine light, one of your warning signs is, hey, leakage, urgency, frequency, nighttime trips, the feeling of incomplete emptying where you feel like you have, even though you went to the bathroom, you feel like your bladder still has urine in it. And again, activity avoidance. These are warning signs. This is not normal. It's common. It's common with people that have had babies. It's common with people that get older, but it's not normal. It's your signal that something's off and you need to get it addressed. So what's the hidden cost of this condition? Waking to urinate at night affects 50% of adults. And 50% of women with pelvic floor dysfunction report pain during sex or decreased in sexual desire. That's the side thing that people don't talk about, but it affects your sex life too. 2 out of 3 women exercise less or not at all due to leakage, right? They don't want to have that embarrassment, so they don't even exercise. And then 48% of those with urinary incontinence experience anxiety, and they're 2 times more likely to experience depression. So let's talk about the limited solutions available right now. Option 1 is a lot of people do nothing. They just think, I have to live with it. The doctor can't help me. And they just live with it. And over time, it typically gets worse. And so living with it, doing nothing, it's a terrible option. Option 2, some of the medications to help treat the symptoms. Option number 3, pads. Putting pads in so you can go longer and without finding a bathroom. And 4 was surgery. So let's talk about medications. Oxybutynin, this one is the number 1 drug for it, and number 2 is mirabegron. Let's talk about oxybutynin first. Dry mouth, big side effect, and it can really plague people with this medication. It can also cause constipation, blurred vision, so now you have eye trouble, and then just making you tired, making you drowsy, not up to the best. And then some people even get cognitive impairment. I mean, confusion, memory issues, dementia, all from just trying to treat the size, basically treat the symptoms with medication. And mirabegron, different side effects, but it can be devastating, right? Hypertension, elevated blood pressure. The last thing you want is high blood pressure. And taking this medication, you've really got to watch for high blood pressure. It can cause headaches. It can even, oddly enough, give you common cold symptoms where you're feeling stuffy, you're feeling congested, or even your nose running, and it's really from the medication. And it can cause urinary tract infections and even back pain. I mean, the problem with all these medications, as you already know, is there's so many side effects. You end up taking 5 other medications just to handle the side effects. And then there's surgery, right? Surgery can be effective for a period of time. Some of the surgeries can give you 70% relief, but there's always the risk, right? Going under anesthesia is not child's play. There's always a risk, and one of the big risks is blood clots, and then continued pain after the surgery, the risk of infection, and then it can fail, right? There's no guarantee the surgery is going to work, and it can cause new problems, and there's recovery time and limited activities. But what they find is with these surgeries, even when they're effective, the chances of you needing a second surgery within 5 to 10 years is over 50%. So don't think you're going to be one and done if you get surgery. It might work, but you've most likely a big chance that you're going to need another one. So here's one of the things people don't talk about. In 80% of all these cases, the number 1 cause that's not being addressed, guess what it is? It's pelvic floor weakness. Those pelvic floor muscles they surround the urethra. That's basically the tube where the urine comes out when you urinate. And when those muscles get weak, there's nothing to keep that urethra from just opening up on its own and not having good integrity with a full bladder. And so the pelvic floor is a huge cause. And for women, it starts off, they're having problems usually after babies and the stretching that goes on. And in men, they can have prostate problems, and that can cause a pelvic floor weakness. But this is not readily addressed. So here's the great news. The pelvic muscles can be rehabilitated at any age, meaning they can be strengthened, they can improve. And it doesn't matter if you're 44 or 94, your pelvic muscles can be strengthened and the function improved, and which leads to decreased or eliminating your symptoms altogether. So how do we do this? This is basically medical breakthrough as far as technology goes, using magnetic field therapy. It's amazing. You basically, with all your clothes on, there's no risky procedure. You basically sit on this chair, and it stimulates those muscles and actively exercises them. So we use that as the foundation of our therapy. And then we do a specific type of nerve stimulation too when it's needed to help rehabilitate the nerve that goes from your brain to your bladder. Some people's issues, along with the pelvic floor muscles, is the communication from the brain to the bladder is not strong. And over time, it gets weak, and you don't have a good strong signal to get a good strong contraction of the muscles. So we help strengthen that nerve by stimulation, which is again another non-invasive thing that you don't have to do anything surgically. It's just a device that's painless, and it just helps stimulate that nerve. And then there's important nutritional support. Make sure you're on an anti-inflammatory regimen so your body can heal. And that's so important. When people talk about inflammation a lot, and inflammation, it's like you want to, it's kind of like a fire. If you can imagine a fire in a house and the fire department shows up, you can't start rebuilding that house until you put the fire out. Well, in your body, we want to dampen the fire, which is inflammation, so your body can heal, your bladder and your muscles and everything can work 100%. So we work on the whole body and all these different methods. So this is originally German engineered solution. They did the research, and it's patented technology. There's an 87% success rate, and there's over 11,000 contractions per session. And these are involuntary contractions. It's not painful. It's stimulating the area that's super hard to ever address on your own. So people talk about doing Kegels to strengthen the pelvic floor, but the truth is you're never going to be able to get the kind of contractions and the consistency that you can by just sitting on this chair for a short period of time. So let's talk about clinical results. Some reports, 67 report, they start feeling results immediately within the first few visits. Everybody's different, and everybody needs a different amount of visits, but 67% they feel improvement almost right away. 78% feel a decrease in nighttime trips, and 93% decreased use of pad usage. I mean, that's significant improvement. This is after a full treatment protocol, which is different for everybody. So imagine you're having these issues, you're not doing the activities you used to do, you feel isolated, and now you can go out and start enjoying life again. Doing exercise, hanging out with your friends, being away from a bathroom for an extended period of time, not wearing uncomfortable pads. Imagine what would happen if this worked for you. This is a typical patient. I no longer leak at all when coughing or sneezing, and I sleep through the night. And she started feeling a difference right away after 2 weeks. So this is a typical patient that's a successful candidate. So what are the next steps? Well, I encourage you right now, if you have these symptoms, reserve an evaluation, you'll come in the office, we'll complete an assessment, we'll get our recommendations, and then we'll begin treatment. And we have a very special way of doing this. Let me explain it to you. Before I do that, people are going to ask me, what about insurance? How much does this cost? And that's a great question. And the thing about insurance, they want to do as little as possible, as I'm sure you already know. And one thing they would rather have you do is take these medications and basically live with it. And if it gets really bad, then they would pay for surgery for you. But they really want you just to ignore it and do nothing. So unfortunately, insurance won't pay for this procedure. And the patients that come to see us, they're looking to take proactive action for their own health, responsibility, knowing that. But that being said, we're sensitive to the fact that insurance doesn't pay for it, and it's an affordable treatment. Just about everybody can afford it. And the best part is, the first step is to come in for an evaluation. The normal pricing for the first visit is $249 for a complete history evaluation to make sure you're a good candidate. And because you're here on this promotion, what we're doing today is we're going to do a full evaluation, and we're going to give you your first treatment. You're going to experience this therapy right away, so you can see for yourself and feel the effectiveness of it. And so with that, we're going to get, it's regularly $249 for this first evaluation, but we're also going to throw in a free treatment, and then we're going to back the price down to $89. So basically you're in a discounted full evaluation, and you're getting a free first treatment, so you can see exactly what's going on, test drive what we're talking about, see for yourself how this is going to help you, and get help going right now.